Hi, everyone. My name is Dr. Geri-Lynn. I am a licensed psychologist. I specialize in conducting evaluations in forensic-based settings. So I like to work with a lot of folks, adults and juveniles within the prison system. And then I also have a small private therapy practice as well. And I work for a pharmaceutical company on new drug development within the addiction and mental health space. So thank you for having me. I appreciate it.
Let's get started. I think it's a little after 12. People will probably still be signing on, but we're good to go, I think.
Okay. All
Feel
right. So
free to share what
yep,
you
bear
should be
with
the
me.
listener. Yeah.
I'm going to try to share this presentation. So let's pray that the technology gods are with me today. Can everybody see my slides?
You're good.
Okay, good. Now let me just go in here and let's do from the beginning. Okay. So I can't see everyone. So will there be someone monitoring any questions in the chat?
I'll do that.
Okay, all right, awesome. And I'm sorry, what was your first name again?
Darcy.
I'm sorry, say that again.
Darcy?
Darcy. Okay. Oh, you're Darcy. Okay. Nice to
Yes,
see
I'm
you, Darcy.
Darcy.
I've exchanged so many emails with you. So awesome. Nice to meet you.
Nice to meet you.
Yeah. So this presentation has two different parts to it. I wanted to personalize what it looks like working with individuals who struggle with addiction, but a large part of that group really doesn't focus on family members. So yes, it's really difficult for the person who's actually struggling with addiction and severe mental illness, but it's also just as challenging for the people who love them and for the people who are closest to them. So when I present this particular topic, I will use some of my personal story as an example to kind of show, mental illnesses and addictions impact on everyone that falls in its orbit. If there are any questions throughout the presentation, please don't hesitate to ask in the moment. I'm sure Darcy will be monitoring everything. And then I'll also hold questions for the end of the presentation as well. So I will go ahead and get started. These are disclosures that I have to share. My work within the pharmaceutical industry on the medical team, working on new drug development and education. I am PsyPAC certified, so I'm able to conduct therapy in 42 different states. A lot of my private practice, like I had mentioned, is within forensic-based settings. So people who've gotten themselves in trouble, but the people that I'm drawn to are those that have gotten in trouble that have what we would consider a serious mental health concern in conjunction with, drug and alcohol abuse issues. I have a documentary out called Utter Nonsense. That is a film that's available on Prime Video as well as Apple TV, and again, talks about the impact of addiction on the family system. And then two books, Mainlining Philly, Survival, Hope, and Resisting Drug Addiction. That's a memoir. And the other one's called Aftershock, How Past Events Shake Up Our Life Today, largely focused on what I call life trauma. So the objectives in this particular presentation are going to really help folks gain an understanding on how addiction impacts the children and the loved ones of people who are struggling. Again, I'll use parts of my personal story to kind of highlight that. And then understanding really that, folks who struggle with drug and alcohol dependency problems, it's usually in conjunction with another serious mental health concern. And I will use different examples to highlight what that looks like. As a psychologist, and I'm sure as many of you folks on this call, we use the Diagnostic and Statistical Manual for Psychiatric Disorders, the DSM-5, to help us from a diagnostic standpoint, determine, symptoms or a symptom presentation that fits with our clients or our patients. And what people fail to realize is that, depression, eating disorders, paraphilic disorders, it's all in the same book, as individuals with drug and alcohol concerns. But I feel like we constantly separate, you know, drug and alcohol, or people who struggle with drug and alcohol are somehow different than people who struggle with depression. So there's still a lot of stigma around mental health concerns in general, but really if you struggle with addiction, specifically addiction to, substances and alcohol, I feel as though there's even more stigma put on those individuals, but it's all from the same Bible. It all comes out of the same book, which is the DSM-5. So just something to remember. Learn preventative measures. We'll definitely talk about preventative measures to decrease the risk of drug and alcohol abuse in adolescents and children. One of the main things is just talking to them like the little humans that they are. Fear mongering typically doesn't work with kids. The more you say, just say no, the more they're like, hell yes, let me try it, especially because my mom and dad are telling me no. So I'll share some information about that. And then obviously learning tips and resources for providers about how to engage individuals who may be struggling with drugs and alcohol. When I say providers, not necessarily those that are mental health and that are trained, but maybe medical providers, how to kind of engage in a way that's a little bit more, helps make more of a meaningful connection and helps kind of bring down some of the defenses of the individual who may be receiving services. I'm sure you've seen this 100 times, the little handy dandy diagram to the left. And I use language like cards stacked against us. I'm from Philly. The longer I do this presentation, like as time goes on, I might talk faster and faster. So feel free to kind of slow me down. And I'll use a lot of just regular slang terminology or nomenclature. So cards stacked against us is one of the things that I use in this presentation. So one of the things that we have to remember with all mental health concerns, addiction, depression, bipolar 1, schizophrenia, is that there is a significant genetic component that goes into this. So yes, it's not just your environment, it's also genetics. In my case, for example, both of my parents struggled with addiction, and both of my parents had mental health concerns. My mom more so. There was a family history of mental health concerns. My mom's side is 100% Italian. And, back in that generation, when they immigrated here, we don't, you don't talk about mental health, and God forbid you talk about your feelings. It's like, we don't talk about that. We just kind of drown that in some red wine. But there was definitely, severe mental health concerns, what we would refer to back in the day as manic depressive, which is bipolar 1. That's what my maternal grandmother had. And then she, passed that same type of mental health concern on to my mom, because there is a strong genetic component with bipolar 1, not bipolar 2 disorder. So what did that do? That created, an environment as a child of parents who struggle with addiction and mental health concerns. It created a pretty chaotic home environment for me. My house was known as, what we would call kind of like a flop house. So the more my parents, were pushed into the throes of their addiction, the less I was taken care of. And that's just a fact, right? That's just what it is. I was an only child for a very long time till my parents got separated. They hooked up with people that were younger than them who wanted children. So then I have all these half siblings kind of walking around that are anywhere from 20 to 15 years younger than me. So it was all the fixins of what you would consider, poor genetic predisposition, because both my parents struggled, and a chaotic and abusive upbringing. So all the fixins of cards being stacked against me, this is pretty much the road that you're on, kid, and this is what's probably going to happen. But I had a saving grace. And at least this is what years of therapy has helped me conclude. My parents, though they struggled a lot, they did something that was really cool for me. And this is what I mean when I talk about preventative measures. As young as 5, 6 years old, after my dad got out of prison, he was incarcerated for manufacturing and distributing methamphetamines in Philadelphia, in addition to, abusing them, coke, whatever else was going on. Um, he educated me. So from the time I was young, after he got out of prison, we lived in a two room efficiency, not 2 bedrooms. So one room we slept in, the other room was not even a full kitchen. It had like a sink and a fridge and a hot plate. And then the bathroom was down the hallway. So it was a boarding home. And that's kind of where we lived because, my dad wasn't making illegal money anymore from dealing drugs. So that's kind of where we were. And I remember my dad, and this is one of those, I don't know if you've learned about like flashbulb memories or it's a core memory of mine. My dad sat me down and he said, Geri-Lynn, look at this. Like, look at how we're living. We're all smashed together in one bedroom sleeping. There's no living room. Mom's cooking on a hot plate. I'm trying to make ends meet because I'm trying to do things the right way, right? Instead of the wrong way. And he said, it's all because of the choices that me and mom made. And it's because, I chose to do drugs, and your mom did, and I didn't get my education and I didn't take care of myself. And I feel really bad about that because now I have you. And my dad, though many people in the space today would say that this is the wrong thing to do. My father described addiction as a monster that lived inside my brain. And he said to me, you have a monster that lives inside your brain, but here's the good news. And I'm scared to death. I'm 5 years old. Like, what the hell is this guy talking about? I'm like, now you're scaring the shit out of me. Um, and he said, but here's the thing. It doesn't have to wake up. He said, you're different than other kids. So as you get older, kids are going to drink, they're going to smoke weed. He goes, and they may be fine doing that. He's like, but you may not want to do that, Geri-Lynn, because you could wake up the monster and the monster likes things like that. And those things lead to where we are today, which is in a 2 room efficiency. And my dad's busting his ass trying to figure out a way for the first time in his life to make a decent and an honest living. So that was the first conversation I had. Again, I'm little. And when my father would talk, he was very charismatic and he was the kind of dude, and I don't know if anybody's come up against someone like this, you just liked listening to him. Like you never felt lectured. When he talked, you were kind of like, all right, like this guy knows his shit. Like I know I'm gonna listen to him. He knows what he's talking about because he's very animated. He was very personable. And I listened to him and I enjoyed listening to him. I never felt lectured. So my parents' attitudes towards drug and alcohol for me was one that was just do yourself a favor, man. Like stay away from it. We know it's going to happen, but look what happens. This is what happens, Geri-Lynn. This may be what happens to you. We want to kind of give you a warning. Not saying every kid whose parents struggle with addiction are going to be this way, but this is kind of like my life advice to you. And I listened to him. So he would talk about that and he would talk about education. Now, this is a guy who dropped out in 9th grade and was dyslexic, that he wasn't properly evaluated. He was probably at the end of his life on a 6th grade reading level if he was lucky. So when I talk about cards being stacked against you, yes, you have genetics, right? Yes, you have environment, but let's look at kids and adolescents, if you work with them, who have what's called a neurodevelopmental disorder. So kids with ADHD, kids that have a learning difference like dyslexia, kids who struggle academically in school, that's a kind of like a weakness in the Achilles heel, if you will, because school years suck. And I'm just going to call it especially middle school. They're tough, tough years for kids, especially middle school before high school. And it's hard for you to just figure out, what's going on, peer pressure, how do I look? Is this person like me? Does that person like me? Let's add social media, Snapchat, Facebook, Instagram into the mix and all that drama. And now I'm having a hard time picking up what the teacher's putting down in the classroom because I have a learning difference. I'm not typical. That puts you at risk for getting involved in things like drugs and alcohol and for other mental health concerns like depression and anxiety because you start to feel like crap about yourself. So my dad had all that going on and I learned that not not directly from him per se, but just from listening to him over the years. And as a psychologist trained psychodynamically, it was cool. I was able to kind of conceptualize my parents and put it together. So that's another thing against him. And that's kind of what led to some of his own, you know, exploration into drugs and alcohol. It was a whole hell of a lot easier to cut school and hang out with other kids who were messing around than it was to sit in a classroom and feel like they were speaking Greek when you only understood English. So just something else to keep in mind. And kids act out, right? Behaviorally, they'll act out, they'll get in trouble, they'll say crazy off the wall stuff because they're struggling and they don't understand what's going on. So something to keep in mind. So we look at unaddressed learning differences, we look at neurodevelopmental disorders, and of course, peer influence. All my friends are using, so I'm going to use. Now, the stronger and the more consistent conversations parents and caregivers have with their kids prior to middle school, because you're going to learn it all. Once you get to middle school, that's when you're going to get all that education from peers. And now with social media, you're getting all this garbage even more. And kids think they know more because, everybody's Dr. Google, right? So they look things up and they think they know more than they actually do. So you want to have these conversations consistently throughout the developmental life cycle, and the language and the nomenclature becomes more sophisticated depending on the kid's developmental level. So just something to, to keep in mind when we talk about addiction. I conceptualize it as a symptom, not as necessarily a diagnosis that stands on its own. I look at it as a response to something else that's happening with you that you don't know how to cope with. That's how I look at addiction conceptually. Some people may look at it differently, but that's how I conceptualize it. I find it to be more symptomatic of something much larger that's going on with the person. So addiction is due to 50% genetics, we know, and then 50%, what's going on with the environment and coping skills. So my parents, absolute train wrecks. But what did they give me? They gave me the gift of honesty. They gave me the gift of being straight up. And they gave me something else, self-concept and self-esteem. Parents, my father, if I was like, I want to run through that wall, and it's the hardest wall, he'd be like, you're damn right you're going to run through that wall. And you're going to run through that wall better than anybody. So my parents believed in me. They encouraged me, even though they were kind of messed up. And it gave me a sense of I'm worth it. And a lot of kids and people and adults that we see later in life, they never had that. There was never anybody saying or acting or like, yeah, like you're worth it, man. Like I believe that you can do this. I think you're a smart person. I think you're this. I think you're that. Not blowing their heads up, not gassing them up as if, they're going to play Division I soccer when they can't kick a soccer ball, but just letting people know like there's things about you that are positive and good and that you're going to do something good with yourself. So think about that when you think about the adults that you treat. It's very interesting to see what their life was like as a child and adolescent, because you'll learn and you'll see that even though there may not have been abuse, was there somebody that had their back? Was there somebody that believed in them? Was there somebody who invested the time to talk with them about the crazy, shitty things that life can throw your way? And there's a lot of it, as as we know, like there's a lot of mishaps and things that can happen along the way to throw you off your path. 1 in 8 kids that are under the age of 18, they live in a household with at least one parent who has struggled with substance use disorder. So, and it doesn't have to be both, but one's enough, believe me, because usually that other parent may not be able to attend to the kid the way that they want to because they're managing their partner and they're trying to keep a roof over people's heads. They're trying to keep them fed. They're working, they're picking up extra shifts. So, you know, when you think about it, it's tough. You got kids rolling up in school that you don't know what's happening at home. And for me personally, I did what I think was a good job, but it probably wasn't looking back of really covering up how bad things were at home for me because I was ashamed. I was embarrassed. I wanted to just have whatever I considered to be normal. So I didn't share with anyone what was happening at home. And I tried to project myself as having it together. My clothes looked, my clothes looked good. And, my hair was like, I didn't want to be associated with the shame, embarrassment that was my family. So, and it's hard, kids are just trying to keep it together every day. Now imagine keeping it together when you have such a dysfunctional and crazy home. Again, something to keep in mind as you treat these adults, because all these kids grow up and they become adults. Um, there's increased risk factors for kids. So child maltreatment leads to, DHS being involved, or children and youth services being involved, trauma due to parental neglect, and then, removal, and then welfare services, and different things happening. There was CYS involvement in my home because I had a much younger sister. And I remember, I wanted her to be home as opposed to not being home, because there was an incident where another family member that we weren't close with had tried to take her. So as a teenager, I took on a parentified role where I'm making sure there's food in the fridge. I'm making sure the house is clean, because I don't want my little sister, I don't want my family member to be taken. I don't want the family to be broken up. So there's a lot of pressure and a lot of things, even if you're not the one struggling, that kind of develops your identity and who you are, and what kind of an adult you become. Um, so mom, just to be specific, she struggled with opioid use disorder. My mom started in the 90s, and her trajectory is probably very similar to what you heard. She couldn't support her pill habit anymore on the street because it was too expensive. So she made the transition from Percocet to heroin, initially snorted heroin and then inject it. And, did anybody sign up for that? No. Did she ever think she would be doing this? Absolutely not. But she did. And then, benzodiazepine. My mom liked anything that made her feel down, anything that made her feel like she could be outside of or escape from herself. That's what my mom was very much into. Formerly diagnosed with major depressive disorder, and at different times bipolar 1, depending on the provider that was assessing her, generalized anxiety disorder, post-traumatic stress disorder. Dad struggled, like I said, with learning differences. So he had dyslexia, probably ADHD, a very, very, very abusive home, extremely abusive physically, with the children, and then with his parents. And then also there was sexual trauma from an older sibling. So that's kind of the path, my dad went down, and then my parents found each other at 16, and they had that in common. And then, they were off to the races as far as their own dynamics go. Um, and another thing I just want you to be mindful of is today my mom is in her 70s by the grace of God. I don't know how. I have no idea how. My dad has since passed at 61 from pancreatic cancer. But she no longer is struggling with opioids. That was a 30, probably like a 25 to 30-year run. She last used in 2019. She was dependent on fentanyl. Um, But she doesn't do that anymore, and that's great, and I'm happy. But what does she do? She has now become drinking. So there's something out there called transfer addiction, but it's greatly minimized. So you have a family member or loved one that's shooting dope, that's what we call it, and that's out on the corner, that's down. I grew up half of the time in the Kensington section of Philadelphia, and the other half was Northeast Philly. So you have your mom on the streets in Kensington doing what she has to do to support her habit, and she stopped that. But now, as an older person, she's drinking. So people will tell you, what, at least she's not shooting dope. But let's not minimize it. There's transfer addiction there. So she gave up one for another, and that is still painful. That still causes problems. Maybe not to the extent in her mind that it has, but it has for our family. So, just keeping that in mind. Transfer addiction could be anything. It could be pornography, it could be gambling, it could be, there's other poor coping skills that people pick up, even though they may put a drug down. So just something to keep in mind. Same with my dad. He gave up by 1985. He wasn't shooting heroin. He wasn't shooting meth anymore. He was sober for a long time, didn't really work any type of fellowship. Um, Managed to only drink on holidays for years, for 10 years, and then goes and buys a bar at D in Somerset and Kensington. What a freaking great idea that was. So what happened? He gets involved in a crazy relationship, and then he starts drinking. So then alcohol ultimately is what gripped both my parents later in their lives. Any questions so far? It's good. Okay. So trauma. So I had mentioned earlier that I look largely at addiction, substance addiction and alcohol addiction as a symptom of something else that isn't being addressed. Trauma is also something that is foreshadowed, that really may not come to the front when you're working in an inpatient facility, or an outpatient facility for somebody that's struggling with opioid use disorder. These folks, in my experience, and I've been doing this evaluative work for quite a long time, doing different evaluations for drug court, for behavioral health court, general evaluations for the courts. I have never, in my experience, have diagnosed someone just with opioid use disorder or alcohol use disorder. It's always accompanied by another significant severe mental health concern. Trauma is one that can happen all throughout the continuum. But one thing that you want to keep in mind is people may use, because of trauma, sexual abuse, neglect, verbal abuse, physical abuse, but there's a lot of trauma that happens while you're out there supporting your habit. Perfect example. I couldn't tell you, how many times my mom came to me, and even myself, friends that I've had, but we'll use my mom as the example because she's somebody who struggled with opioid dependence and lost friends. Just so many of her people she considered friends died from overdoses. Or I work with people, women, men, it doesn't matter, who tell me the things that they did to support their habit. And a lot of them may have been sex workers, but that's what they did to support their habit, but they've been brutally raped, brutally beaten. And there's not a lot of empathy. They go, oh, well, you put yourself out there. And that's, so terrible things happen. Sorry, Darcy, I see there's a question. I see your hand raised.
Yeah, I didn't want to cut you off, but I want to just ask a question that Sophia had for
Sure.
you. Do you want to go ahead now and do it?
Sure.
Okay. Are all transfer addictions necessarily bad, or can they be encouraged for progress like working out or even recovery meetings?
It's so funny that you say that, because, and again, this is in my experience, folks that I've worked with, um, they like to fill the gaps, they fill the void. Me, for example, I never became addicted to drugs per se, but I was dependent upon chaos because I grew up and I thrived in chaos. So what I look for now is an occupation that still lends me that chaos, that on your toes, that having to keep going. So you'll see a lot of that. You'll see people become um, infatuated with being healthy and working out. I've worked with folks who went from shooting bundles of dope to telling me they're not going to take Tylenol anymore because, they don't want to put any substance in their body. So yes, to your point, there are what we would consider societally acceptable transfer addictions where you'll see people over exercising, becoming infatuated with even the 12-step process. They might go to 2 meetings a day every day for the rest of their life. Now, are we going to say anything about that? No, because they seem to be productive. They're doing okay in life. But there are instances where I've had people who overexercise, who've gotten too far the other way, even though it's considered healthy initially, but it can be a problem. So that's a really good point. I have seen that, and there's definitely socially acceptable, I guess, addictions, right? Or things that we may jump into. But here's the hallmark. Here's the thing you want to look for. Are you able to be functional? Are you able to be productive? Are you able to meet the basic needs of yourself and your family and who you're taking care of? And if that answer is largely yes, then I don't think there's a need to pathologize. That makes sense. Okay. Okay. So I think I covered this, when you talk about trauma, let's look at it pre, during, and post. And the post isn't really talked about much. So yes, you can have something terrible happen to you that where you lean on drugs and alcohol, or you lean on negative people to get through that. There are traumatic and terrible things that can happen to you in your addiction. An example of that is engaging in criminogenic behavior that can then cause trauma, home invasions or robbery or sexual assault, the experience of being incarcerated, that can be very traumatizing. And then let's talk about the post. Now that you've made the decision to become sober. People think, oh, this is great. Like so and so's in rehab. Like I can breathe again. Yeah, you may be able to breathe. I remember my mom would go away into rehab. I always knew that she'd make it through detox. So I knew I had about 5 good nights to sleep. But after detox, I would hold my breath because I didn't know if she was going to go over to inpatient rehab. And then sometimes she would, and it would be great. But I share that because getting sober and trying to live a life that was so drastically different than what I lived, and now having a criminal record most of the time, and now having burned every family bridge, and now not having any type of support, that in of itself can be traumatizing. I'm working with an individual now, intelligent, very smart, went to school, finished his education, got in trouble around that time, has felonies. And now this poor guy is trying to do the right thing, get a job, and he can't. And that's traumatic because you want to do the right thing, but you're still paying for what you did, and it's hard. And that can really mess with someone's head and give them a sense of feeling defeated, feeling bad about themselves, trying to get out of a rut. And that can be a very traumatic thing to have to undergo, in addition to just learning how to live sober and confronting all the people you hurted and confronting all the all the pain you caused others. That in of itself is difficult too. So when we think about trauma, don't just think about it as these isolated big events. Just living can be traumatic in general, right? Like for people who may not have severe mental illness and addiction, but now add that on top and you're dealing with some pretty complex cases. So there's a lot of mistrust when they roll up and they finally make the decision to come see us, whether they're court mandated or not. There's a lot of mistrust there. There's a lot of fear. They're afraid they're going to be judged because they probably have been judged. So you want to keep all that in mind, try to be empathetic, but at the same time, let them know that you know what time it is and that, they're not going to try to pull one over on you, right? If they lie about relapsing or whatever it is. Relapse in my opinion is something that may be part of their recovery process. So am I going to shame the shit out of somebody who comes to me and says that absolutely not. We're going to talk about it. Let's talk about why. And it doesn't have to be a big why either. It could be something as simple as boredom. Boredom is a huge trigger for relapse. So just, kind of thinking about these things. So, let's talk about, yes, I think we did a good job of talking about how it impacts the person, but it impacts the family members too. And one thing that I think how it impacted me was what filled me up and what continues to fill me up is my work, my professional life, my personal life. Nothing is ever, for me, it was like, hey, once I get my license as a psychologist, I'm going to feel like I made it. I'm going to feel fulfilled. I did that. And I was like, no, like, what's the next thing? What's the next thing? So I'm very, very perfectionistic and hard on myself. I put a lot of pressure on myself to try to be the best that I can. And I think that's largely correlated to feeling so much judgment as a child of parents who struggled, that I not only want to show you that I'm not like them and that I can do well, but that I can do fabulous, that I can do better than the kid that had it all. And I think that's a perspective that I've carried with me through life that's been both a blessing and a curse. And it's something that I still struggle with. Another thing is the inability to relax. I can't relax for the life of me. Even when I have like my true crime shows on, like I'm still washing the dishes or I'm cleaning or I'm doing something. People will often say that's a trauma response because you feel like you haven't earned the right to just relax. And I can definitely relate to that. And then unwarranted, where does that come from? It comes from unwarranted feelings of guilt and shame, right? Like you're carrying the burden of what your family of origin has been labeled as. And that's a big burden to carry. And then you're trying to recreate a family for yourself that's not that. And you just want to do so well. And you don't want to make any missteps or mistakes because you don't want your kids to grow up how you grew up. So it's it's the hedonic treadmill. And the hedonic treadmill is like you're on it and it's like, you know, nothing ever kind of feels like it's good enough. So that's something that I kind of deal with in myself as being the adult child of parents who struggle with addiction. Couple more things, and then I want to shift that into the actual treatment paradigm. But when you talk to kids, you don't talk at them and lecture them. You talk with them. And another thing you do is you let them know you're human. Like, parents do this thing where they shelter. Oh, I never did that. Or I don't want to tell my kid that I got high at a concert and I threw up. Or I don't. Yes, tell your kid all that stuff. Tell them it. Tell them all. I did this. I messed up. I hooked up with a person. You be honest, because that's one thing my parents did. And their honesty and their humanity, it gave me a position where like I felt like I didn't have to go out and make my own mistakes because theirs were good enough. And it's because they were 100% real. So the more real you can be, the better. And I don't say that. I don't want you to fear. There's no like just say no and don't do. Why? Kids want to know why. They always ask why. Why? Tell them why. Be straight up and tell them why. Of course, on their developmental level, tell them why. And it's not one conversation. It's not two. It's not three. It's any opportunity you can. Like my son the other day, he's 14. He'll be 14 on Tuesday. We're sitting in my kitchen and he hadn't seen my mom for a couple of days. Usually when my mom's not around, she's out on a bender, she's drinking, and I don't like her to come to my house drunk. So I do have certain boundaries. But I still want my mom to have a relationship with my kids. So, sometimes she'll come and she's a little hungover, beat up a little bit, if you will. My son turns around, he's like, Mom, oh my God. He's like, so this is in my genes? I said, what do you mean? He's like, so like how Mimi is. He's like, that could happen. And he asked the question and I took 5 minutes to answer it. And then we kept it moving. It doesn't have to be this big thing. You just, when there's opportunities to plug and play, when they're telling you about their friends, when they're telling you, you take the opportunity, you plug it in and you move. So talking with your kids, being real, humanizing, being non-judgmental, like all that stuff, in my opinion, I feel like it goes a long way. My son's 14. I hold my breath every day. So I hope it works. It worked with my sister to an extent that I adopted her when she was 10. So it worked with her. I hope it works with my kids, but I'm holding my breath, so we'll see. Okay, positive sense of self. Got to get, instead of what I observe a lot when it comes to adolescence is, and it's different from when I feel like I grew up, but these kids today, there's a lot of pressure academically and there's a lot of pressure athletically or artistically. So like we used to play soccer and there was a soccer season and soccer season. Now Jimmy has a conditioning coach. Jimmy's going to go out for AAU and play the national circuit, and Jimmy's 13. Like, relax. There's a lot of pressure that we put on these kids. Just let them be and cater to and support what they love. And the main thing is, let them be competitive, but have fun. So I know we want everybody to do well, but sometimes there's a lot of undue pressure. So there's a difference between encouraging your kid to believe in themselves and then trying to form your kid into the next Michael Jordan. There's a big difference there. So just things to kind of keep in mind as you're working with younger people who then end up being the adults that we sit in front of. So what does this have to do with treating the whole patient? Well, it has a lot to do with it because what I gave you is kind of a glimpse or a journey of what people who may struggle with substance use disorder look like. It's not just that. There's a lot more that goes with them than just somebody who has, opioid use disorder, or just somebody who has, alcohol use disorder. There's a lot more going on. And they come from a lot more than you may think So when you look at medication-assisted treatment, which a lot of people enter into is, the medicine, we can check that off because we don't want anybody in active withdrawal or anybody sick. They can't work with you if they're not being managed medically, right? Because their main thing is to feel better. So once that's together, then you have the behavioral health component, which everybody will say you need therapy. Well, that's great. Or you need group therapy. And then where the ball, in my opinion, the ball can drop at any point in time, but where the ground falls out is social determinants of health. You are dealing with a population of people who don't know where their next meal's coming from. They don't know where their head's going to lay at night sometimes. They don't know how the hell they're getting to their therapy appointment. So like you want to talk about therapy and I don't even know what tomorrow is going to bring. So social workers, case managers are so peer specialists, they are so important to an individual's recovery to where I can't sit there and do therapy if I got a poor guy sitting next to me that doesn't know where the hell he's going to sleep tomorrow. So it starts from the bottom up. Yes, medication, we want to help with withdrawal, but basic needs. Where are you getting your next meal? Are you in a safe environment? Can you sleep at night? What's your record look like? Because of course, everybody wants you to work. Probation wants you to work. Well, let's see if we can get you employed. Are you able to report into probation? Can you get there? So keep all of that in mind. So when you're working with these people, you're kind of like a sliver of the pie. You may be doing the therapy and the therapy goals are, let's make sure that they abstain, from drugs and alcohol. Well, that's a lot easier said than done when you got a lot of other stuff going on. So keep that in mind when you engage these individuals because they're in a scary place. Sometimes the hustle of the street and getting high is way more comfortable than what it looks like to get better. And I think that's something that we forget. And so when you engage these individuals, it shouldn't be, oh, so did how you feeling? Like, do you have any triggers? Like, are you using it? Like, let's get past the triggers. What's going on, man? How you feeling? Like, you feel comfortable where you're staying? How things like, have you talked to your kid or your daughter who hasn't talked to you in 10 years because you've been out in the street? So it's things like that that I feel like we have to be aware of before we can cover all of this other stuff in a therapeutic dynamic, if that makes sense. Mental health concerns leading to addiction, chicken or egg. You kind of, know how I feel about this. Yes, you can have stuff going on before, but you have stuff going on during and after. Sometimes with depression, the depression can be due to all of the chemical neurotransmission in the brain being knocked off because when you use drugs, you're releasing so much dopamine that just normal amounts of dopamine that you get from eating chocolate cake, sex, watching a good movie ain't hitting it. So what happens is your neurotransmission is a little off and you just feel malaise. You don't feel well neurochemically because the drugs and alcohol have taken your neurotransmission off the radar. Plus, yeah, there's external things that make you feel like crap and garbage that you haven't addressed because you've been getting high. And now you have to face all those feelings that you've been drowning out. So keep that in mind. So when they come and they sit across from you, it's not like you have to say what I'm saying, but it's just something as simple as like, this is your time, man. Like, this is your time. So like, what would what do you feel comfortable talking about? Where do you want to start? I'm not going to push you. I'm not going to push you to talk about this and that if you're not ready. Tell me where you want to start. What's bothering you today? How you feeling today? And some people may say, well, I'm only here because I'm court mandated. Okay, that's fine. We can sit here. So it's all about, people talk about motivational interview. It's really about meeting people where they are because you have to build that trust. And then I kind of talked about this, psychotherapy. It helps to address mental health concerns, which includes addiction. Addiction should not be separated. It's all in the same book. But for some reason, people who struggle with substance use and alcohol are more so substance abuse, they're looked upon differently. And I get it. They're looked upon differently because they do some pretty crazy shit in active addiction to support their habit. I get it. I've seen it. I've lived it. I understand it. But at the end of the day, it's a mental health concern just like any other. And folks should be looked at in that like through that lens. Like you're not here to judge. We're here to kind of work with people who want that work, who want that exchange. People talk about, psychotherapeutic approaches. Are you cognitive behavioral therapy? Are you psychodynamic? I'm eclectic. I'm gonna do what I have to do at that moment with that individual, right? So it's never your agenda. If you walk into a session thinking that it's your agenda and what you want to talk about because you know what so-and-so needs, you've already ruined the session. Session's over. You got to meet them where they are. And then as they trust you and then you can start challenging them. But you have to build rapport before you can get down before you can get to, they have to respect you. And they have to know that you know what time it is before they're going to open up to you. And that goes for anybody, addiction, not addiction. It's just mental health in general. And then I think the worst thing, and I'll kind of, I'll kind of leave it here. Our worst enemy, I don't know, I'm probably showing my age. There was a song by a group called Lit, and the song is It's No Surprise to Me. I'm going to sing to you guys now. I am my own worst enemy. So it's about literally like you are, and people in recovery, people with mental health concerns, people with it, we are our own worst enemy because most of the things that we commiserate about are here. We don't have the facts to support them. We really beat ourselves up in here. So if you can get somebody to feel comfortable enough with you to share with you what's going on in here, that's awesome. Because now they're telling you like why they may be behaving the way they are. And you're your own worst enemy. So help them understand the difference between fears and facts. Just because you have a fear doesn't mean it's an actual fact. And then encourage honesty through psychoed. You have somebody that relapsed. You have somebody that says, you know what? I still want to keep on using, or I'm going to use on the weekend. You don't discharge them from therapy if they're still showing up. That's archaic. You say, okay, well, what are you using? Now in today's world, people say, well, I'm using dope. I'm using heroin. Well, where are you at in the country? Because I know most folks here in Connecticut, it's fentanyl, it's alpha-2 agonists like xylazine and medetomidine, it's lidocaine, tetracaine, petrocaine, it's the opioid supply is maybe 5% opioid. So give them the harm reduction tools, educate them about the supply, let them know where they can find, safe supply, meet people where they are, because your psychoeducation about what's in the supply if they haven't used may be what prevents them. So just educate them on what's going on and stay fresh on what's going on out on the streets so that you can have those intelligent conversations with your clients and with your patients. Avoid the shame spiral, man. It's not our job to make people feel bad. They already feel bad enough. You don't have to pile on, because guess what? They're not going to come back. And you want them to come back, right? You want them, even through relapse, people, when they relapse, they say, oh shit, I screwed up. Counselor Marie is going to be so pissed at me. You want to be like, hey, I'm not going to be pissed. I'm just happy you came today, man. Like, thanks for coming. So get rid of the shaming, and then positive praise. I had a client, and she had a beautiful voice. She was like singing, I was waiting to see her. She was on the female unit. And I turn, I'm like, man, you have a beautiful, I don't know, just a simple compliment. She smiled, she's like, that just made my day. So it's little things advocate for them. Let them know that you're in their, give them a compliment. Tell them, hey, that's a great job. You looked for jobs today. That's awesome. I'm proud of you, man. Keep up. I know it's hard. Keep at it. So it's really just making those human connections. It's being non-judgmental, but I just hope I gave you examples of what non-judgmental looks like, because sometimes we think we're not being non-judgmental when we are. So just simple things, if they relapse or something happens, still be open and accepting. So just things like that you can do. And then keep in mind, you are a small piece of what they're trying to put together. And it's not just about triggers. It's not just about not using. Let's talk about all the shit you're dealing with that could maybe help you not want to use. And just keeping that open mind. And I think that's all I have. I included some resources. If somebody needs a therapist, I like the Open Path Collective because they have sliding scales. So if somebody's in between insurance, you can refer or have them look at the Open Path Collective. You can get sessions, or people can get hooked up with a therapist for as low as $20 a session. And I know that still may be a lot for folks, but at least it's there. There's telehealth platforms, BetterHelp, Talkspace, and then there's other different kinds of supplemental supports that can be used. Like there's wellness apps. I use Headspace a lot because it helps with sitting and meditating and trying to relax. And there's small meditations. They can be 4 minutes long, because you best believe I don't have it in me to meditate for 30 minutes, because that's way too long for me to get outside of myself. So there are a lot of different things and resources that you can offer. And I just stuck a few of them up for you there. So this is my contact information as well. I don't have anything else, but I am definitely open if anybody has any questions.
I just wanted to say I really, really appreciate like your brutal honesty, how open you are, and a lot of the things you said, like I hope, I think it's going to stick to a lot of us, and I really hope that we can like utilize it with our patients, more so now than ever after hearing what you've had to say. So thank you so much.
Thank you.
I agree. Are you seeing the questions, Dr. Otter, or you want me to read them out to you?
I think I can see them now.
Okay.
I just saw just a couple comments. I think I answered I think the questions were from earlier.
Yep, you're
Awesome.
Any other questions or comments?
I just want to say I really appreciate your perspective about honesty too. Like especially with kids, like, and that's like very much how I feel too. But so often people are like, they want to act in that, or they want to operate in that more of like shielding kids, which is understandable. I can understand that perspective, but I think there's so much more like longer term benefit when we do have those developmentally appropriate but honest conversations. Because then I think later on down the line too, that can help like prevent, or at least try to prevent shame, because it's like, okay, we talk about things, from a young age. So it's like, it's not just in the short term why we're having these honest conversations, it's long term too. And obviously we know, shame can be such a big part of addiction and mental health. So breaking down those barriers early is definitely like a preventative message. So, or preventative measure. But want to echo what Erica said too. I really appreciate you sharing your story and just being here and sharing all of this wealth of knowledge and experience with us.
Thank you so much. Thank you so much, Madison. I appreciate that as I cough in everyone's ear. Where do I stand on self-disclosure? I think that really depends on my rule of thumb on self-disclosure is you only self-disclose for the benefit of the client, not for your own, not for the not to just simply self-disclose. So it really depends on the situation. And it depends on if I feel as though it's going to help a client. I don't normally self-disclosure is something that I will do very sporadically, but only if it makes sense on behalf of the client.
What I found interesting, Dr. Utter, too, on a personal level, both my husband and I, we have a daughter, both my husband and I had differing opinions on whether to disclose history, right? And we kind of got into it a couple times over the years. She's now 28 years old. And after listening to you, I'm telling you, I'm going to go back and have some conversations with her that I should have probably had long ago.
Yeah.
Who knows?
I mean, I don't think it's ever too late. And that's the one thing, that I think that gave me like a path to follow is they didn't just say no. They told me why, they shared why, and I lived why. Like I suffered the consequences of their poor choices. And I looked around and I was like, shit, like I don't want to, I don't want to do this forever. Like I don't want to know where my next meal is coming from. Like I want a clean house and so, but the fact that my dad was able to put the two together and he said, we're living like this because of this, I think that's what really stuck with me. And then when he said to me, hey, by the way, kid, like this is kind of in your blood. I think that scared me in a good way. Like today as an adult, like I may very occasionally drink. But like I said, control is something that I latch on to. So anything that makes me feel out of control, it's just not my twist because, that's kind of what I don't want to say my addiction is, but that's what like I need to stay like this at all times because I don't trust, I wouldn't trust if I did something like that, the propensity to become addicted. Yeah, Gloria's comment about educating their family about addiction. It's huge, and it's ongoing. And I, you know what, I get a lot of calls about, because I do a lot of advocacy work too, of like of parents of adult kids. When I say kids, I mean like 19, 20, 21, 22, and that's heartbreaking. Because at that point they're technically adults and there's not much that can be done. So really making sure that the family understands addiction and that they have their own support system works. I've done Al-Anon a couple times. And I think Al-Anon can be great if you get a good group. But for me, there was just too much. I think it made me feel too vulnerable, and I wasn't ready for that. So I went for a little bit and then I kind of stopped. Past history, and they have been abstinent since, oh, Eleanor, since before the child's birth, some of that. I think whether they've been abstinent for 20 days or 20 years, I mean, I think sharing those experiences in a human way with your kids about anything. Like my husband was a really good college athlete, and he got injured, and basically went into a terrible, terrible, terrible depression, really bad depression, and went down a pretty dark path, and shared that, like it's not drug related, but he's sharing that with my son now because my son's super competitive. So I think sharing any life lessons at any time, if you think it'll help your kid, why not? And for the abstinence, like if they were abstinent before the child's birth, like, is it because they feel shame that they have to disclose to their kid that they once struggled? I mean, I hope that's not what's holding them back.
I have a question. Can you hear me?
Yep.
Hi, my name is Donicia. One, thank you for just being so open and honest and just being authentic, because I know a lot of us as counselors, like, we have patients with stories like that. So my question is, I've seen you have put in one of the slides, like sometimes we're like that only person for our patients, like they've lost a lot of people, family's not in their corner anymore. I guess I'm looking for, like, if you got any tips maybe, or some advice for like when you have a client like that. I'm looking at it in two aspects. Either we're literally like the only person, like family has cut them off, or I've also seen people who are like ashamed, like that stigma, like they don't want anybody in their family to know that they're here. And, you know, like we offer family sessions and stuff here, but they're just like, nope, my family doesn't even know I'm here. Like, how can we continue to support them with these limited social supports?
I mean, I think the first part of your question, let's say they've burned, like it's more of a burned bridge situation where nobody wants anything to do with them anymore. I think just you're modeling. So it's not so much like what you say. It's just the consistency. It's like they can come and they can say, like, Denise, they can be like, Denise, you, like, I messed up this weekend. I did. And the fact that you're like, all right, man, like, let's talk about it. Like, that's all, that's it. Like you're still, I'm here. We're there. We're going to figure this out. Like, let's talk about it. I think that's huge because so often, you know, a lot of people have boundaries and thresholds and they walk, and I get it. I understand, but the fact that you're there and you're saying, let's figure this out, you're modeling behavior for them that they very much need to see. It makes them feel better. If there's still shame and they're like, I don't want my family to know I'm here, that's a great opportunity to, let's talk about it. Like, why don't you, not as simple as like, why don't you want your family to know? Like, I psychodynamically, I'd be like, well, let's talk, like, what was it like growing up? Like, why do you think they would be upset? Like, what is it? And kind of get it. And then hopefully, you know, the encouragement could be at some point in time, you might learn that they may really want to be able to be more open, but they couldn't be because of their own stuff, or they couldn't be because of them. But either way, in the therapeutic relationship you're building, the more you can learn about that, the more you're going to learn about your client, and the more your client's going to be able to figure out whether or not they should, you know, it's the right thing to self-disclose, because it may not be safe. Certain family members aren't safe, right? But you don't know that yet. So I think the more you can get them to talk about childhood experiences and about what they, you know, love or don't like about their family, the more they're going through talking to you, they're going to see, maybe I should, or maybe I really shouldn't.
And like you said too, it just takes time, like building that therapeutic relationship. Thank you. That was really helpful, because I just got a few people on my caseload, or they're in those situations. So I'm trying to see like how I can continue to support them.
Yeah. Yeah. And sometimes family, like, listen, like family's family, but sometimes family isn't sucks, regard like addiction or not. You know what I mean? Just because you guys share the same blood doesn't mean that they're privy to understanding and holding your emotions and feelings, because they don't deserve that sometimes. So,
Thank you.
yep. We're pushed to offer IOP or clinical group, but not everyone is ready to accept. Yeah, I know. I know how that works, how that game's played, and I've ran IOPs that were like mostly mandated, and you know, it's funny because sometimes I feel like I got one of two clients. One is like, shit, I'm here. I don't want to be here. My PO says I got to be here. And then you're like, I get it, man. Like, I get it. Because you could probably teach this IOP because this is probably the fifth time you've been mandated. I get it. Do you want to so it's just meet them where they are. Because sometimes they don't need IOP because they've been through 5 IOPs. But it's the shitty part of the system. So are you going to sit there and be like, well, you need to do this, or you're going to be that person? Like, you showed up, thanks for showing up. If you want to share, you can share. It's cool. That's kind of how I would look at it, because I get it. And I hate that IOP and 30 meetings in 30 days. I hate when all that shit's recommended, because it just goes to show we haven't taken the time from an evaluative perspective to really get to learn what that person needs. But we're not going to violate parole or probation, because who wants to go back? I want to discuss with a child about what the parent should have choice, but how the patient is actually educated. Again, it's all on developmental level. You know what I mean? I think it's important. Another thing too is early assessment with kids. You know, you want to make sure there's nothing else going on with the kid, because that puts them at a higher risk for putting themselves out there when it comes to using Snapchat, all that stuff. The other thing too, and I'll just put this out here. The other thing too that I've noticed with kids is the expectation on social media. Posting, talking, engaging. Everybody's real brave behind a keyboard. So it's constant. When I was coming up, if somebody didn't like you, you knew that you saw that person that didn't like you from like 8 to 2:30, and then you went home and you could get away. There is no escaping anymore. It's constant. Your bully can be in your ear 24/7 with kids. So I think the importance of explaining what a social media diet is, you know, not having them on all the time, getting them involved in activities that don't require screens. Um, I think a lot of that stuff can be helpful. And, you know, if you're a mom, like, open up a damn TikTok account. You want to see what your kid's doing, start a TikTok. That's what I did. Get in there from the back end. You know, like, just, it's tough. Yeah, it's definitely it's tough. And talking to your kids about social media is important too, especially with the amount of pictures, the naked pictures. I don't know if you guys know what sextortion is, and that's a whole nother thing these kids are dealing with now. So you have a young, we'll just say a young boy that really likes this 14-year-old girl that he thinks he's talking to, that really isn't a girl. It's a group of maybe older kids or whoever, and then the boy sends pictures of himself. And sometimes in some cases that I've had, the boy may think he's talking to another boy because he's homosexual and has not come out to his family yet. And he's sending pictures, and then that group or those people who are posing to be another similar aged peer say, well, now I'm going to post this all over your Facebook, all over your social media. I'm going to let your family know. And then and I want $5,000 for me not to do that. And then what ends up happening is the kids become severely depressed. Some of them will attempt suicide. So there's a lot of things that these kids have a different level of pressure on them than we did coming up, that I think we need to be mindful of. Anybody have any other questions?
Question. Are you selling your documentary?
Oh, it's on Apple TV and Prime Video. So yeah, I
Oh,
think
wow.
it's $5. Whatever it is, you guys can check it out. I do a lot of speaking engagements around it, like in Philly, like in the Pennsylvania, we have Pico, that's our electric provider. And it's cool. Like Pico created a group, a stigma group, for the employees and the families, and they screened the film, and then we did like a Q&A with the cast. It was really neat. So so that, you know, the film's doing what I hoped it would, which is just helping people understand a little bit more and be a little less judgmental.
Interesting.
All right, well, if that's it, thank you guys so much. I appreciate
Thank
you
you.
having me, and I hope everybody has a good rest of the week and weekend.